Symposium of the Stanford Center for Precision Mental Health and Wellness. I'm thrilled that today's symposium is co-hosted by both our Stanford Center for Precision Mental Health and Wellness and by the Major Labs and Clinical Translational Neuroscience Incubator within the Department of Psychiatry and Behavioral Sciences at Stanford. The Major Labs Incubator is directed by Drs. Karen Parker and Vinod Menon. We have a shared goal to achieve better diagnostics, treatments, and eventually cures for mental disorders. We are thrilled that you've joined us today. As a quick side note before I get into the program, you may hear a little hoarseness in my voice. It is nothing scary or catching. I had a wonderful visit back to my home country of Australia, which was very, very humid. And now I have not acclimatized to the dry air and AC. So hopefully you won't have to read my lips. You'll be able to hear me. So we have an exciting program to share. In the first session, you'll hear from our plenary speaker and our first keynote, and the first presentation from a rising star early career investigator. And then we'll wrap up with remarks from Dean Lloyd Minor, who's the Dean of the Stanford University School of Medicine. And then we have a wonderful lunch for you. In the second session, you'll hear from the second keynote speaker and the second rising star presenter. These will be followed by the directors panel hosted by myself and co-director Ruth O'Hara, and that will be a chance for an extended Q&A and a deeper dive and more informal discussion. And we've done that in response to feedback from last year's symposium that more discussion would be welcome. At 3 p.m., we'll move to an extended happy hour. We'll have 2 hours of happy hour and a wonderful poster session, which is just in the room adjacent. And that'll be a chance to see research from across labs in the center. As you may experience throughout the day, we designed this event to encourage in-person interaction between you and the speakers, and to allow time for discussion and chat. So please take advantage of that. I'm incredibly grateful to our speakers. Not only will we hear about their exciting work, but they will stay with us throughout the day to engage in discussion and answer questions. For those unable to attend in person, we will have recordings available later. Through today's program, we hope that you will gain a rich experience about exciting and momentous changes in mental health. You will hear about how mental health is being reconceptualized as brain health, leveraging the explosion of insights from neuroscience and data sciences. You'll learn about new approaches to understanding individual experience of disorders such as depression and OCD by understanding the brain. And that gives us a way to start to personalize treatments and develop exciting new directions for rapid-acting therapeutics. These discoveries make me very hopeful for the future. They make it possible to realize the vision of a precision approach in mental health and make a positive difference in countless lives. We're excited for today's symposium. As I mentioned, the symposium is being recorded with the exception of the second keynote. Please visit our website and you'll see it listed on the slide here. And that's where the recording will be posted and also available on our YouTube channel, which is listed here as well. We have a photographer here today, and photos of the event will be also shared on our website. Please share our event as on your social media. We will have it on our social media, but please tag us PMHW and share widely. I really encourage your questions and discussions. We'll have a short Q&A after each talk, as I mentioned, and then the extended panel session. To ask a question when it comes time, we will have microphones available standing microphones, which you can see at the sides, and we'll have a roving mic coming around if it's hard to get to them. If you think of a question that isn't answered live, we really want to answer it, as do our speakers, so please email it to us, and you can email our precisionmentalhealth@stanford.edu email. For pragmatics, restrooms are to the right, so you go out of here and turn right and right again. And then I also would love, if you're not already, to have you join our center as a member. And the sign-up information is on our website, and there's more information on the table in front of you and in the lobby. We also would love your recommendations about speakers in our seminar series, and you'll hear more about that later in the afternoon. If you have exciting research to share, we want to make it known, so please send it to our email address. And before I turn to the introduction to our wonderful plenary, there's some important notes of recognition. Firstly, I express my huge appreciation and heartfelt thanks to those behind the scenes who make this possible. Hosna Omazad, who many of you will have interacted with, pull this all together, along with Anna Boken, and my lab, several of whom you'll meet on the front desk. Also, thank you to Li Ka-shing, audiovisual and facilities team, Jan, Theo, and Kyle. I want to recognize all of the members of our center who are doing such important work, spanning many areas of precision mental health, from neuroimaging modalities, computational approaches, wearable technologies, and novel therapeutics, to name just a few. I'll talk about some more of those when we get to the panel. Now, let us turn to our plenary speaker and kick off our program. It is my honor and my delight to introduce our plenary speaker,